Margaret is 67 years old and feels pretty good. She gets up 3 times every night to use the bathroom. She feels more tired than usual lately. Her blood pressure went from 125 to 138 in the past year. When her daughter asks about it, Margaret just shrugs and says it's part of getting older. Nothing to worry about. Then her doctor calls with blood test results. Her kidneys are working at only 35%. That's stage 3B chronic kidney disease. Margaret is shocked because nothing hurts. She has no symptoms. The damage happened silently over many years. Hello, friends. Today I'm going to share 5 mistakes that are quietly destroying your kidneys. Most doctors never explain these until the damage is already done. Your kidneys are incredible organs. They filter your entire blood supply about 40 times every single day. That's roughly 200 liters of fluid being cleaned daily. But here's the scary part. Your kidneys can lose half their function before you feel anything wrong. By the time symptoms appear, serious damage has already happened. That's why catching these mistakes early matters so much. Prevention starts right now, not later. Mistake number 1. Not drinking enough water. Your kidneys are begging for water right now, but you can't hear them. Most seniors walk around dehydrated for years without knowing it. You might pee 6 times a day and think that means you're drinking enough. Wrong. Dark yellow urine, waking up at night to pee, fatigue, dry skin. These are your kidneys screaming for help. By age 65, your thirst mechanism is so broken that you could lose 2% of your body weight from dehydration and still not feel thirsty. When you don't drink enough water, your blood becomes thicker and more concentrated. Your kidneys must work much harder to filter out waste products. This extra work creates oxidative stress inside kidney cells, damaging them over time. The concentrated waste can form crystals that irritate kidney filters. Less water means less blood volume flowing through your kidneys. With reduced blood flow, your kidneys get less oxygen and fewer nutrients. This limits their ability to heal and function properly. A 2011 study in the Clinical Journal of the American Society of Nephrology tracked over 2,000 adults for 6 years and found low water intake caused kidneys to decline 1.3% yearly versus only 0.5% with good hydration. The same 2011 CJASN study showed people with low urine volume had 54% higher risk of rapid kidney decline. A separate 2024 study in Renal Failure Journal found dehydration increased diabetic kidney disease risk by 169% in nearly 5,000 participants. Drink 6 to 8 glasses of plain water daily. Don't wait for thirst. Set phone reminders every 2 hours. Keep a water bottle visible. Morning habit. Drink 2 glasses upon waking. Check urine color. Dark yellow means drink more. Light yellow or clear means good hydration. Mistake number 2. Ignoring blood pressure numbers. Many seniors see 135 or 145 and think that's acceptable. Their doctor said medication starts at 140, so anything under seems perfectly fine. Some feel completely normal at 150 or 160 with no symptoms. They assume good feelings equal healthy kidneys. This dangerous belief is destroying their kidneys every single day. Your kidneys contain millions of tiny blood vessels called glomeruli, smaller than human hair. When blood pressure rises above 130, excessive force pushes through these delicate vessels. The constant pressure causes tiny tears and scarring in kidney filters. Once damaged, they cannot repair themselves. The scarring becomes permanent and worsens continuously, reducing kidney function forever. High blood pressure also reduces oxygen reaching kidney cells. Less oxygen makes them weaker and less able to filter blood. The damage accumulates year after year. A landmark study of 316,000 people found blood pressure between 130 or 139 nearly doubles kidney failure risk. At 140 or 159, risk increases 2.6 times. At 160 or higher, risk jumps nearly 4 times. Even slightly elevated pressure silently destroys your kidneys over years. Your target blood pressure should be under 130 over 80, ideally 120 over 80 or less. Check it weekly at home with a monitor. If it creeps up, reduce salt immediately. Walk 30 minutes daily, lose weight if needed, manage stress with deep breathing. Don't wait for medication. Mistake number 3, drinking too much sugar. You pour yourself a glass of orange juice every morning, thinking it's healthy. Maybe you sip sweet tea all afternoon. Perhaps just one soda daily. You believe natural sugar from juice is better than soda. That belief is wrong. Sugar, and especially fructose, create a toxic process inside your kidneys right now. When fructose enters your body, it behaves differently than other sugars. It goes straight to your liver and kidneys for processing. This creates uric acid as a waste product. Uric acid forms tiny crystals floating in your blood that damage your kidney filters. Fructose also depletes energy inside kidney cells, creating stress that triggers inflammation throughout your kidneys. This exact same process causes fatty liver disease. When your liver becomes fatty, your kidneys must work harder to compensate. The damage accumulates silently over years without any symptoms. A 2024 study in JAMA Network Open of 127,000 people found drinking more than one sweetened beverage daily increases kidney disease risk by 19%. Drinking 4 or more weekly increases risk by 96%. Having fatty liver from sugar increases kidney disease risk by 43%. Stop all sweetened drinks immediately. No juice, no soda, no sweet tea, no energy drinks. If you want fruit, eat whole berries instead of drinking juice. Drink plain water, unsweetened tea, or black coffee only. Read every label and avoid high fructose corn syrup completely. Limit added sugar to under 25 grams daily. Mistake number 4. Not managing stress and poor sleep. You constantly worry about your health, your finances, or caring for your sick spouse. You sleep only 5 hours each night, or wake up multiple times. You never connected stress and poor sleep with kidney damage. Most people think kidneys only respond to food and drinks. That's completely wrong. Your stress is destroying your kidneys. Chronic stress releases cortisol continuously throughout your body. This hormone raises your blood pressure, causes inflammation in all your organs, and reduces blood flow to your kidneys. Poor sleep activates your sympathetic nervous system. This is your fight or flight response staying turned on all night long. Your blood pressure remains elevated during sleep when it should drop significantly. Both stress and poor sleep trigger inflammatory chemicals that damage your kidney filters gradually every single day. Your body cannot heal your kidneys while constantly stuck in stress mode. A 2024 meta-analysis of over 2.6 million people found sleeping under 5 hours increases kidney disease risk by 46%. Sleeping over 9 hours also increases risk by 46%. A 2021 study showed chronic stress disorders increase kidney disease risk by 23%. Sleep apnea doubles your risk. Aim for 7 to 8 hours of quality sleep every night. Go to bed at the same time daily. Make your bedroom dark and cool. Practice stress reduction with deep breathing for 5 minutes twice daily. Walk outside in nature regularly. Limit news watching. If you snore loudly, get tested for sleep apnea immediately. Mistake number 5. Ignoring insulin resistance. Most seniors have no idea they have insulin resistance until diabetes gets diagnosed. But your kidneys started getting damaged 10 to 15 years before that diagnosis. You might have prediabetes or metabolic syndrome right now without any symptoms. Your doctor says your blood sugar is normal, so you think everything is fine. Meanwhile, your insulin levels are dangerously high and destroying your kidneys. Insulin resistance means your cells stop responding to insulin properly. Your pancreas compensates by making more and more insulin to force sugar into cells. This high insulin level becomes toxic to your kidneys over time. It damages special cells in kidney filters called podocytes. These cells act like guardians, preventing protein from leaking into your urine. High insulin also causes widespread inflammation, creates more uric acid, raises your blood pressure, and forces your kidneys to filter too hard. This hyperfiltration exhausts your kidneys. All this damage happens years before your blood sugar ever becomes elevated. A 2023 study in kidney research and clinical practice following 3,131 people for 11 years found insulin resistance increases kidney disease risk by 40%, even with normal blood sugar. A 2011 CJASN meta-analysis showed metabolic syndrome doubles kidney disease risk. Prediabetes already shows 30% increased kidney damage odds. Ask your doctor to check fasting insulin and HOMA-IR score, not just blood sugar alone. Cut out all processed carbs, including bread, pasta, rice, and cereals. Eat more vegetables, healthy fats, and moderate protein. Walk for 15 minutes after every meal to use up blood sugar. Lose belly fat. Reverse insulin resistance before diabetes develops. Pick one mistake to fix starting today. Start drinking more water or cut out one sugary drink this week. Small changes add up over time. If this video helped you, please hit the like button and share it with friends or family who need to hear this. Drop a comment telling me which mistake you're fixing first. Don't forget to subscribe for more health tips. Your kidneys can still heal if you take action now. Disclaimer: this content is educational only and does not replace professional medical advice. Talk to your healthcare provider before changing your diet, medications, or treatment plan for kidney conditions.